Take the white crescent at the end of the nail seriously. Have you ever noticed the white crescent at the end of your nail? They are actually called nail lanulas and provide valuable information about our health. In addition to announcing the state of health, nails also help sensory functions and play a protective role for fingers and toes. This part of your nails tells important secrets about the health of your body, all of which we have told in this section of Moist Health. What is a nail crescent? Lanula means small moon and is a white, crescent-shaped area that can be seen at the end of the nail. The nail matrix is the tissue or the part from where each nail starts to grow, and also new cells are made in this place. Lanulas are part of the matrix and come out from there. If you are deprived of nail lanulas or you have seen their color change, see a doctor if you experience the following symptoms: dizziness and distraction, weakness, tiredness, indifference to favorite activities, significant weight gain or loss, unusual requests such as the desire to eat clay. Nail lunula, nail conditions and its relationship with health. According to the philosophy of Oriental medicine, since nails express the state of health, any changes in their color, shape, and size are important, and if you have the following, you should pay attention to them. 1. The lack of crescent nails. If your nails are not crescent-shaped, don't worry too much, because changing their shape does not always mean the presence of a disease. Lanulas can easily hide under the skin of the nail. Lack of lanol can be a sign of anemia, malnutrition, or depression, but if lanol is not present in your nails, then your kidneys are in trouble. According to a study, changing the crescent shape of the nail is associated with thyroid and pituitary gland problems, as well as vitamin B12 deficiency. Be careful that there is usually no lanula in children's nails, and it will appear when they grow up. In some people, due to the physiological nature of the nail structure, the lanula is invisible. 2. The presence of lanula in the nail of the little finger. According to the philosophy of Eastern medicine, the lanula is not found on the little finger. Each person's little fingernail is connected with his kidneys, heart and small intestine. If lanula is seen in the little finger, it may be due to high blood pressure. 3. Presence of lanula bigger than fingers. The lanula should usually cover a third of your nails. If you find that this size is more, you should look for thyroid and blood pressure tests. It is a little difficult to say whether the crescent of the nail is bigger or not, because the size of the lanula in each finger is related to the size of the nail, so if your blood pressure and thyroid are normal, don't be afraid. 4. Color change of lanula. White lanula indicates healthy and normal nails, but if the lanula changes color, you should see a doctor. Graying of lanula. It indicates chronic fatigue, digestive disorders, and problems in absorbing nutrients. Purple lanula. It indicates poor blood circulation and as a result lack of oxygen to the organs and tissues of the body. If you have a change in color along with headache and dizziness, be sure to see a doctor. Pink or red lanula. It indicates cardiovascular disease and hematological malignancy. Lanula in red can significantly affect your health. Red lanol is a symptom of the following diseases: collagen vascular disease, heart failure, chronic obstructive pulmonary disease, cirrhosis, chronic urticaria, psoriasis, carbon monoxide poisoning. Therefore, if you see red lanula, see a doctor immediately. Azure lanula. Generally, cyanosis is caused by the use of autoimmune drugs, including chemotherapy drugs, other anti-cancer, and anti-AIDS drugs. Also, azure lanula indicates diabetes mellitus, methemoglobin, and Wilson's disease. Wilson's disease is a very rare genetic disorder that causes large amounts of copper to accumulate in the liver, brain, and other vital organs. Some of the symptoms of lanula azure include tiredness, lack of appetite, abdominal pain, jaundice, eye color change to brown gold, accumulation of fluid in the leg, difficulty in speaking, uncontrolled movements. 5. Lanulas in each nail. Each nail represents a part of the body. When the lanula changes under the nail, the cause must be sought. Lanulas may not be visible on the little finger. In this situation, the function of the liver will be directly related to the heart and intestines. If the lanula on your little finger is too large, it indicates high blood pressure, ring finger. It shows the health of the reproductive and lymphatic system. If the lanula is hard to see in this finger, you should seek treatment for your digestive, intestinal, and lymphatic problems. Middle finger. This finger is responsible for the functioning of the brain and nervous system. So if there is no lanula, measure your neurological and vascular problems. Finger. It monitors the functioning of the intestines and pancreas. Pollex. Generally, there is lanula in this finger, but if it is not, you may be dealing with lung and spleen problems. Smokers and people with high blood pressure are associated with this problem. 6. The shape of lanula. Lanulas are related to nail growth. If the lanula is deformed, your nails will lose their shape as a result. If there is a problem, the lanula may become square or triangular. Lanula pyramiding can occur as a result of a blow or improper manicure. People with Downs, Edwards, and Patous syndrome usually have broken lanules,